Hi everyone, a very good evening to all of you. Since the date for FMG is announced now, we are left with 75 days. And so many students have so many queries. That's why we have organized this interactive session with our senior mentors for our medicos. So ladies and gentlemen, first of all, I would like to take up the opportunity to introduce all of them, to welcome all of them. We have a group of senior mentors with us, and yes, I feel privileged to welcome them. So first of all, Dr. Rajiv Dhawan sir is here with us. Dr. Rajiv sir, like ENT faculty and one of the most active personalities on social media and very famous among students, and like who has been a source of inspiration and a ray of hope for so many times. So I would like to say. And yes, we have Dr. Sonu sir with us. Dr. Sonu sir, we have not met in person, but so far we have not met, but I know you personally, sir. I know you socially, sir. You are being loved by the medicos, and you have made this subject microbiology very, very easy. So thank you so much for joining us, sir.
Thank you, sir. Thank you.
And we have Dr. Sandeep Sharma, sir, also. He has also joined us. Dr. Sandeep Sharma, sir. Sir, thank you so much for joining us, sir. Dr. Sandeep, sir, is known for his charismatic personality, very active, very dynamic person. And Dr. Priyan, sir. Okay, like sir, from the students, he's being known as a cute doctor, but a strict professor. He's very strict in the class, but he's being loved by so many FMGs. And I think Dr. Khalid sir is also going to join us very, very soon, who is known as the real guardian for so many FMGs, right? So, sir, like agenda of this seminar is like we have some queries, like last 75 days are left. So few queries which I have noted down from the students, sir. First thing, sir, I am having so much anxiety. What to do? Second, we are not able to recall whatever we have learned. Revision is a big problem. This is taking too much time. I'm not scoring well in recent mock exams. I'm able to score hardly 120, hardly 130. So, sir, so what should be my strategy? And like in last 75 days, how many revisions will be appropriate for the exam? So we can start with Rajiv Dhawan, sir.
Thank you, Nadeem. Nadeem did not speak about himself actually, and I must tell, Nadeem is one of the faculties like students adore, and we are very fortunate to have him as teammates. And Priyansh and Sonu. So I think this panel indicates that how much Doc is passionate about the like FMG welfare. And coming to your question, sir, 75 days means 2.5 months, and this is the time which is the game changer.
True, sir.
The game can change in both the directions. I just coming from Gautam Nagar, sir, the hub of the FMGs. The two type of groups which are rampantly visible now. One group is सर पढ़ लिया, थक गए, नहीं हो रहा, समझ नहीं आ रहा, भूल गया, सब गलत हो रहा, पढ़ाई का मन नहीं कर रहा, सर पहले पढ़ रहे थे अब नहीं हो रहा. वो बिल्कुल सबसे बात करते दो चार लोगों और ये इन्फेक्शन कॉज करते like, and unfortunately what happens is whatever hard work they have done since July mid or July early part, now it was a time to really reap the benefits. But that mistake we would not let you guys do, including those people also who are discussing these things and probably worried about what will happen. So how to go about it? Number one thing is, there will be never a moment in the whole preparatory cycle, including a night before, when you will get this feeling, I'm absolutely prepared for the examination. I'm sorry for that. That will not happen, be it UPSC or whichever exam you want to give. The feeling is always like, I don't know how it is going actually, for the majority of the people actually. So the most important thing is within this imperfect feeling of the half-hearted preparation lies the perfect path to pass exam also. Let us find out that path. Number one step is do not keep on changing your sources and resources. Stick to the resource. Whichever resource you use for X subject, stick to that. Number two, it's a time for now revision. Till now, you have collected the data from X, Y, Z resources. Data collection is over. This is a time for data processing. Data processing means you have to do the revisions now. But revision has to be smarter. Data processing cannot be like, like a theoretical paper revision and all that. Every paper will have, every notes, will have certain parts which are just story building, go faster. Critical data points to be slowed and revised properly. But don't take too much time to revise now. And how would I know, sir, which part are important? Teacher has told you. You have got the idea about the PYQ topics. You already know what a trending topic on the NEET PG side also, and they have been tick marked in your notes somewhere here and there. And faculties keep talking like in the classes, in the videos and all. So the data processing, after that, every day, please do some data application also. If you just revise the content, you are preparing for a theory paper, the written paper. Unfortunately, this is not a subjective paper, it's an objective paper where you have to select one choice out of four. And this has to be practiced. You cannot say that I have been revising theory, and I don't feel like doing question. Like Nadeem sir said that I am feeling low because I scored 130 marks. My question is, did you analyze the GT after giving GT or not? The real thing about GT starts after 5 p.m. Take a break, sit down, look at the subject-wise performance you had, and choose the 3 red areas. Maybe your pharma is weaker, maybe your medicine is still weaker, or maybe your microbiology is still weaker. You need to, it means next time when you do revision or do the subject, you have to be more focused on those subjects actually. Number 2, did you learn from your silly mistakes or not? There's certain question which you knew and you thought something else. He asked about vocal nodule, you thought about vocal polyp. So that kind of confusion happens. Identify the silly mistake you did in that GT. And thirdly, and very important thing is, you know what, these GTs, whenever you do, they are the indicator what are 300 more important areas of the notes. And please do revise those points also one more time. Little bit of extra thing what I got, you may add, but don't add too much in your notes also, because you would not be able to revise that. So before I go back to Dr. Nadeem, as far as the anxiety is concerned, we'll come back to it. Little bit of anxiety is a part of the game. Please use that anxiety to propel yourself to do more hard work rather than getting overwhelmed with the process and surrendering it. That would not be a good idea. And we'll certainly come back to it sooner. Nadeem, sir.
Okay, sir. Thank you so much for highlighting so many points, sir. Sir, I would like to ask Dr. Sonu, sir, to speak on a few of the queries of the students, sir.
Any specific queries there, sir? Or like on these?
सर इसमें क्वेरीज में एक ये भी है कि सर लास्ट के 75 डेज में जो मोस्ट इम्पोर्टेंट सब्जेक्ट्स हैं तो उसमें वो किस पे ध्यान दिया जाए ज्यादा?
अब सर इसमें like definitely I will have a word like all 19 subjects are important. First mistake which the students they do that they completely ignore up some subjects and then they go into the exam and lands up in 140 to 150 line. So which I have observed over the years. What they have done, they will not do 2-3 subjects itself and they will try to go into the exam without doing them. So this should not be done. Actually, what they should do, like if at all they have not done any subject, like suppose they have not done psychiatry or anything all, but at least PYQs of previous sessions and all that, at least you should be knowing them. Don't go like without knowing only that particular subject. Any forensic, micro, patho, anything. Without knowing up, suppose you have not done the proper classes and all, but at least you should be having an idea about the PYQs which have come. You should be having those single liners and all that. So this mistake I have seen up, and mostly those who have a good thing, like they have a good command over certain subjects, they land up in 140 to 150. This particular phenomena mostly happens with them, and they have not done forensic, they have not done this, and they lands up in this. So from my take is that all the 19 are important. At least like if you can't do proper the full revision and all, see the PYQs. That is very important. At least which you have not touched up till, because most of the coaching institutes have ended up the syllabus and all. And still, if you feel that I am like very weak in this and I will be leaving only this particular subject, so don't leave. At least have something from that. This is one of the things. And sir, as such, sir told revision is what matters. More and more you revise, this is what is there in physiology also. More and more you revise, more better you get. So basically, Funda is all about revision, that how much, and like obviously the crisp thing will be remembered proper. Don't overburden your notes with unnecessary like information which you have got from somewhere. So the very important things are told that stick to your source. Whatever you've done, any platform, but you should stick to your source. That is one of the important things. And besides that, sir, like GT should be given, I suppose. And if you do not giving GTs and all and directly landing in the exam, because I've seen a lot of students, what they do that they get less marks in GT and all around this time. And they leave this thing. Then we will not be giving up and we are having less marks and all and directly lands up the exam. So obviously, if you directly lands up in the final exam without giving GTs, without rectifying your mistakes, definitely again the result will be what? Same. So you can't ignore your weaknesses. You should focus upon them. And I have talked up those who have got 200 and about 200. They always have that particular booklet of 20th booklet, what they say, besides 19 subjects, in which they have written up the mistakes which you have done in the GTs, the any extra information which is relevant, they have marked in that. And they do keep on revising that. Like Sir's, Sandeep Sir's milestones are there. As culture medias are there. So they tend to forget up. So what they should do, they should have a 20th booklet. And in that, they should mark up the things. And at least in the last week or two, they should revise that. So these are the some of the tricks and tips, like from my side. And any other
Thank you
things
so
that
much,
you
sir.
can?
Sir, Dr. Shri is asking one question, so you can answer him as well,
Yeah.
sir. I'm scoring between 170 and 180 in every GT. So could you please suggest how my day should look? I have got 148 in last attempt. Dr. Shri is asking, sir.
It's a tricky situation, sir, because I have met several students who are scoring well in the GTs and in the like these tests and all, and they are the ones which lands up like I don't know how they land below 150. So it's good only, sir. It's a very good score which he's getting up. But only thing is like he should think of that which particular mistakes he is doing up or what rectifications they need. And basically, I think if he has average getting up this, so obviously some subjects are there in which he falters or he or she, whatever is. So he falters up. So should see in that particular direction that particular thing should be rectified. And every day, I suppose they should do MCQs because the thing which they're going to face up in the exam, that should be done properly every day. That will remove their fears also and a lot of other things.
Okay, sir. Thank you so much, sir. So overall, like the most important point, what Sonu sir has highlighted, that all 19 subjects are important, and please do not leave any short subject. Okay, sir. Thank you so much for the valuable suggestion, sir. Sir, now I would like to ask Dr. Sandeep, sir. So many students are waiting for you, sir, and so many students are writing about you in the chat box. So they love you a lot, sir. Sir, so welcome, sir. Thank you so much for joining us, sir.
Thank you so much, sir. Very good evening to all the students and my fellow faculty members. So it's always a pleasure to connect with the students.
Sir, students, like few questions, sir. Like in total, how many mock exams should be written?
Sir, when we say mock exams, I think grand test is what we are discussing. So
Yes.
grand test, see, every 10 to 14 days, you should give one grand test. As Rajiv sir said, after giving grand test, take a break. After maybe 1 hour, come back to the grand test, analyze the subjects. This analysis part is most of the students miss out on. Half of the students don't give GT thinking कि syllabus khatam hoga tab dunga, and by the time syllabus finishes, now you have no time left to give GTs. So irrespective of how many subjects you have done, even if you have done 4 subjects so far, you have to start giving GTs. Give one GT. After the GT is over, within the time limit, of course, not, chatting on the phone and talking to somebody and watching movie or listening to music. As Rajiv sir said, in the evening period, when there is no distraction, mobile phone switched off. Switched off means there should not be any calls coming in. Then you give the GT. After GT is over, take a break for half an hour, then analyze yourself. Suppose you have 19 subjects which have already been done, right? We assume that 19 subjects you have already done at least once. any subject you are able to solve less than 50% of the question means you are in trouble in that area. Suppose there are two subjects. Suppose medicine you said, and medicine you are able to solve only 20% question. When you have already done major systems of medicine already, then medicine is your problem area. On the other hand, suppose there is a subject like psychiatry and 6 questions are there and you are able to get 4 questions right out of those 6, means that with one more revision you can reach as high as 5 to 6 out of 6. So psychiatry is not your problem area. So you need to identify what are the problem areas, what are the relatively problem areas, and maybe give them 5 to 10% more weightage when you do revision. So GT gives you direction for your revision. Secondly, GT gives you time management, whether you're able to finish the topic or not. This is something you would notice. People who have given the exam previously would know. People who are giving for the first time, it seems easy that you will be sitting in the exam and you will be just solving the question. There are 2 papers which are going to be there. There will be time allotted sessions which are going to be there. People get tired. People get fatigued. होता क्या है लास्ट के 15 मिनट में, even if easy questions are there, you are mentally tired, or you know you are feeling hungry, you are feeling sleepy, you are feeling restless. So those things you have to manage. You have to train your brain beforehand that this thing does not happen to you, and GT is the perfect platform for doing that. And number 3, many people say, sir, GT I'm getting score 170 to 180, is it fine? When it comes to GTs, you should be very greedy. I'm not talking about money. I'm talking about GT scores. If you're getting 180 today, why not 190? 190 today, why not 200? Because only when you are consistently getting up above 200, even if it is a tough paper, you'll get selected. Anything below that, don't be content that, okay, I'm now getting 170, 150 to aa jayega. That is not how it works. So GTs are a necessary evil. Acha nahi lagta dena, but every 10 to 14 days, one GT, analyze and see in what direction you are giving. Between 2 GTs, if your score rises by 5%, you are doing fine. At the same time, after 1st January, my personal advice, I may be wrong, do not give any further GT. Last 7 to 10 days, if you give GT and score comes bad, or if it is a very tough GT, you will unnecessarily get demotivated. So whatever GTs you have to give, 1 GT every 10 to 14 days, analyze, no GT after 1st January. Maybe 1st January is the last GT you will give. After that, 12th January will be the only GT or the actual exam that you'll be sitting in. Over to you, sir.
So Dr. Rakesh is asking one question, so you can answer this question well, sir.
Yes, sir.
Sir, with how many MCQs should we start? Should we do mixed custom module or PYQ QBank or module first?
Sir, there are no consensus on this. I personally believe PYQ. Like, I'll give you an example. I got a query from a separate student, which will come to this also. I'll come to this also. He said, sir, when I solve PYQs, my score is very good. And when I do GTs, or when I make a custom module and I add NEET PG questions also, my score drops. I asked him, what is the score? He said, sir, PYQs, I'm getting 80%. But the other custom module, I'm getting 60%. I said, don't be very happy when you are getting 80%. 80% is not acceptable. 80% in PYQ means your preparation is not on track. So please understand, when you solve only PYQ, your score should be 95%. Anything less than that, you are playing with fire. You may get selected, that is a separate story. But PYQ, even if direct or indirect gets repeated, your strike rate should be close to 100%. That is the first thing. Second thing, once your score is above 85 or 90% in PYQ, then you start mixing custom module. I would advise that if your any subject is pending and you're doing for the first time, focus solely on PYQ. For a huge subject like medicine, surgery, gynae, you can focus on PYQs. But when it comes to the revision part, or when you want to attempt the paper again, then in those areas you can make custom module. Try to add NEET PG questions if you want. But INI CET, some of the topics are a bit atypical, so I would suggest not to go for these mixed modules close to the exam. So try to focus more on the PYQ part. And PYQ, the golden rule: any topic, any PYQ repeated more than 2 times, see, is my accuracy in that topic high or not? If not, immediately finish it off.
Okay, sir. Thank you so much, sir, for answering their queries. Actually, so many students are texting. Now we have Dr. Priyansh, sir. Sir, like for you, there is the question that what are the mistakes which we should be avoiding in last 75 days?
Hello, sir. Thank you, sir. Thank you. Am I audible, sir?
Yes, sir. Yes, sir.
All fine, right? What I feel is कि sir, सबको there must be a lot of things are going on in the mind. In these last 75 days हम ऐसा करेंगे, हम वैसा करेंगे. We make so many plans, but the point is कोई भी प्लान परफेक्ट होता नहीं है सर. It's more about how much we are moving forward. मतलब लगातार चलते रहना बहुत जरूरी है. Don't search for any perfect plan कि ऐसा कुछ होगा फिर ऐसा होगा. ऐसा कुछ नहीं है. We all are human. We all feel demotivated. ऐसा self doubt आता है. It's okay to have all these things. The important part is you should move on. You should learn every day. Every day there has to be books with you. There will be many times कि आज पढ़ने का मूड नहीं हो रहा है. जीटी में स्कोर अच्छा नहीं आया तो पढ़ने की इच्छा नहीं हो रही. There are so many things will be there, but it is okay to have all these things, and don't make this GT as your judgmental tool. It's not score अच्छा हो जाएगा. Don't worry about the score. It's more that you learn your mistakes. As Dhawan sir also said, कि we need to learn from what the mistakes you have did during that GT. And see, there are many things are there. We can't control them. Difficult question आएगा, we can't control them. But at the same time, you need to understand in that paper of 300 MCQ, there will be 100, 120 easy questions will be there. अगर हम वो सही कर देंगे, that most of the work has been done. That is very important. We have to analyze that कि हम are we doing any mistake in the easy questions or not? If you are not doing, you are going right. But if a question is coming from your notes which you have revised and you are not able to solve that, then it is not correct. तो हमें we have to look कि why we are not able to solve that. जब मैं GT दे रहा था तब मैं why I have ticked that answer कि गलत हुआ है. What I was thinking at that time, so the same mistake will not be repeated in the exam. And as like I said, sir, I feel that from this point there should be at least 5 GTs to be given to the exam, and last 1 week should not be given any GT. Plus multiple सब बोलेंगे कि multiple revision करना है, multiple revision करना है. But if you see 75 days में, if you are planning to have maybe 3 revisions, then it is only possible if you move your pages very fast. Otherwise it's not possible. अगर हम ये सोचेंगे कि मैं धीरे धीरे सब कंसोलिडेट करते हुए जाऊंगा, you will not be able to come back to your first subject where you have started. So what I feel is when you are reading the notes, don't give the time to your brain to think. कहीं पे ऐसा लग रहा है ना कि याद नहीं हो रहा है, कोई बात नहीं. उसमें देख लो कि सर ने पढ़ाते टाइम कुछ बताया होगा कि this is very important, this is what is very important, and remember that and let's move forward. Let's flip the page, and then again we will come back in the second revision. Again it will be there. But if you go very slow, अभी मैं सब कंसोलिडेट करता हो जाऊंगा, आज ही सब याद करूंगा इस पूरा सब्जेक्ट का, then I will come back again. Then this cycle will be very long to complete the 90 subjects. And when you will come back on the first subject where you started, then it is going to be again, it will look tedious. मतलब वापस हम काफी कुछ भूल चुके होंगे. So flip the pages faster. Give every day, try to do every day at least 100 MCQs. Initial days में अभी शुरू में maybe you can start with 75 to 80 MCQs a day, and later on once you complete at least 10 subjects का आपका revision हो जाए, then you increase the number to 100 or maybe even 120 every day. And whatever tests and discussions are happening every time wherever you are studying, जहाँ पे भी जो भी आप schedule follow कर रहे हैं, जो भी test and discussions हो रहे हैं, attend them. Don't think कि मेरा subject paper नहीं हुआ है तो marks कम आएंगे तो मैं demotivate हो जाऊंगा. Don't worry about those marks. We are here to learn the things, and if we'll do mistakes, we'll learn. We'll remember them in the exam. That is very important. Over to you, sir.
Okay, sir. One question, actually similar question from Dr. Yunus, Dr. Suhaid, Dr. Varsha. Okay, we are stuck in between 120 to 140. We are not able to improve our score. So what should be done?
While reading your notes, I feel that you should think like an examiner. कि अगर आप examiner होते ना, तो how you would have made a question from that particular topic. Don't read the notes in a single direction. Otherwise, your silence will be made in that direction only. Say if we write like Navy, it is seen in dog. Reading the same line in the same direction. If the question come in same direction, yes, you will answer. But if it comes in the other way around, your sinus may not fire at that time. So if you have revised your notes decently and still you are not able to improve your score, what I feel, think like examiner while reading your notes. It will not happen overnight, but subconsciously you have that process with you. Okay, I have to how the and slowly the skill is happening.
Yeah.
Sir, I think some internet
Yeah.
connection.
Yes, sir.
I think Priyan sir की तरफ से. Yeah, okay, sir. I think there is some kind of internet issue from Priyan's side.
Yeah.
Dhawan sir, some more questions students are they are mentioning here. Dr. Shri, like he's asking especially from you, sir, what should my study day look like? How many hours should I average for, like some kind of question that he has asked?
Okay, everyone, Dr. Nadeem, if I am a student appearing on 12th of January 2025 for the FMG examination,
Yes, sir.
maybe first time or second time, how would my 75 days look like, first of all, sir?
Yes.
So I have made my plan as a student. My first cycle of revision now, after the class is over or the video lecture is done, must finish by 10th of December. If I am preparing, I'm telling you, from 11th December to the 1st of January, I will be doing a second revision, quick revision one more time. And the 2nd January, I would keep for the last grand test now, sir. 3rd January to 9th January, 7 days is for the last look of the important points one more time. 10th and 11th is for travel, oblique data, critical data review one more time. And 12th is exam. May I repeat again. 75 days plan from my side as a student for myself is my first cycle of revision would end by 10 December. My second cycle would be for me would be from 11 December to 1st January, where I'll take break on 31st December also for some times. 2nd January is my grand test day. I will review that, the final grand test. 3rd January to 9th January is the 1 week last look program. 10th and 11th are for travel and critical data review one more time before the exam. It's my plan for the upcoming FMG 12th January 2025. How my day would look like, I'm doing self-study now. My day would be, and I would say only what I practice. I would be studying 13 to 13 and a half hour every day. You can say, Rajiv, is it really humanly possible? Yes. And I told Sandeep also that, when I appeared in MRCS ENT exam a couple of years back, I followed the same rhythm and none of us would say anything which is not practically possible. How my day would look like. I would start I generally sleep like, 1 to 6 or 6:30. 7 o'clock when I start my day. 7 to 9, I do biochemistry, carbohydrates. 9 to 9:30, I have a little bit break and I eat something. Don't eat everything. We are eating as if it's the last supper of our life. I don't know why we eat that much. If you eat like a last supper, you will be absolutely retarded. If you have 3 aloo ka paratha or 2 dosa or 1 idli, no one can study on the planet actually. Eat something. It's not the last meal of your life. Okay. Keep the other half for the next break. So 7 to 9 o'clock with the cup of tea, I will already read carbohydrate metabolism. 9 to 9:30, I will have breakfast with less carbohydrates, by the way. 9:30 to 11:30, I'll be doing the biochemistry continue. Carbohydrate part 2 now. 11 to 12, I eat another part of my breakfast. You have tea. Now 12 to 2, carbohydrate continue. 2 to 3:30, I'm going to take a lunch break. I'm not going to really do anything. I'm going to make a call, take a shower, whatever. And I'm going to doze around for 10-20 minutes. I'm not going to really, sleep on the bed. Don't sleep on the bed in the afternoon. Just doze for a little bit while. And again, get ready at 3:30. Today, I will be reading ophthalmology. 3:30 to 5:30, I'll be doing the lens. Complete lens revision. 5:30 to 6, tea break. 6 to 8 o'clock, lens continues. And conjunctiva also finish in that time. 8 to 9:30 is dinner break again. I have to do social media. I do calls. It's called KPRD time. What is KPRD? खाना पीना रोना धोना. कभी लोग रोना धोना भी होता है ना, फोन भी करना, मम्मा नहीं होगा, पापा मेरा नहीं हो रहा, मेरे से कुछ नहीं हो रहा. हॉबी होती है हमारी, कोई बात नहीं कर लो, पढ़ना तो पड़ेगा. 8 to 9:30, you had a good, like break, social media. Dr. Sandeep put something very interesting on pediatric review of what Dr. Sonu Pawar put some microbiology stains का पूरा focus कर डाल दिया. एक ही slide में गुरु ज्ञान बांट दिया आज ही भाई. तो भाई बहुत जरूरी बात है, देख लेते हैं, स्क्रीनशॉट रख लेते हैं, काम आएगा फिर. ठीक है. 9:30 to 1 o'clock आई एम डूइंग MCQ. मुझे नींद आती है रात को. आई फील स्लीपी एट नाइट. मुझे क्या करना है, कैसे, don't do 200 MCQs in a stupid way. I see back-end data and I'm surprised. People are doing 50 questions in 13.5 minutes. It's the fastest finger first going on over there. What is a habit? Anything done repeatedly is a habit. You are playing fastest finger first in October, November, December. How can you play slow way on 12th of January? Tell me. It's not possible. None of you will be doing 50 questions in 12-13 minutes. Minimum time to do question, even in the practice hours at night, is 35 minutes or above for 50 question. Please do not take less time. फिर तुम लोग मेरे पास आते हैं, संदीप सर के पास जाते हैं, नदीम सर को बोलते हैं, सर सिली मिस्टेक बहुत हो रही. कब जब काम ही सिली करेंगे तो सिली मिस्टेक ही तो होनी है. अब फास्टेस्ट फिंगर फर्स्ट खेलेंगे तो 4 चॉइस में कहां पढ़ पाते हैं. ऐसा खेल बन गया है, क्वेश्चन पढ़ते पढ़ते आंसर का मूड बन चुका होता है. चॉइस तो बहुत दूर की बात है, क्वेश्चन पढ़ते पढ़ते मूड बन चुका है, आंसर क्या लगाना है. डोंट डू ऑल दैट. Anything done repeatedly is a habit. Old, bad habit also, good habit also. Let us develop a habit. We will never mark any question without reading all 4 choices, however simple it may be. No problem. After 50 question done in 35 minutes, next 1 hour, I will revise those parts from my notes only. Don't read explanation from new sources, beta. Read your own notes, then, beta. And if anything extra is there, then you read and write one single line on your copy. That's all about it, beta. One more 50 question. I did gynae question 50. Now 50 question of gynae one more time, beta. And I same way I analyze those questions, learned from my silly mistake, wrote my silly mistake on my book only, and I revised those points. Look at the date. Look at the sleep time was 1 to 6 o'clock or 6:30. We did 6 hours of carbohydrate complete revision. We did in 1.5 hour rest also. We did lens and conjunctiva today only. We did gynae question at night also. 50 question of gynae, 50. 100 question done properly are much better than 250 question done randomly. It's not really good idea, man. Who is telling you to do, you, as Sandeep sir said, doing just PYQ is not a good idea. Go beyond PYQ, yes. Increase the challenge level for yourself. Okay? But okay, I asked you next day, bache. Again, you feeling so nice about it. Wow, the day went so nice. You sleep comfortably at 1 o'clock. 6:30 you get up. Today, let's continue lipid metabolism. 2-hour lipid. And 2 hour you do the amino acid oblique enzyme revision. 6 hour, biochemistry is done. At least कुछ तो हुआ भाई. प्रयास ने क्या बोला कि सब कुछ तो नहीं होता, लेकिन काफी चीजें हो जाती. कौन बोलता परफेक्ट प्रिपरेशन के लिए? जितना भी कर सकते करते रहते हैं. उस दिन शाम को हमने क्या किया, 2 घंटे में कॉर्निया रिवाइज किया, 2 घंटे में रेटिना रिवाइज किया, और आज शाम को 100 क्वेश्चन ऑप्स के लगाए. बड़ा 50 का ब्लॉक ऑप्स का, 50 का ऑप्स का. डॉक्टर दमन, इट इज साउंडिंग टू इम्प्रैक्टिकल. आई विल नेवर से एनीथिंग which is not practiced by me. Never. None of us is like that. We are not here to motivate you. I think we really believe in one thing. Motivation is a myth. It's a fraud. We have to make sure that you become absolutely responsible for your result. I want to tell you one thing. If you are hell-bent to waste time in these 2.5 months, because you are not feeling like studying, because you are feeling low, because you are feeling fear of failure, then nature is watching you. Nature will bless you with whatever you are getting afraid of. Nature has no mercy, bache. There is a grace element in the nature, but that is only unlocked when you do the hard work. This low feeling, mild depression feeling, not the psychiatry, not Nadeem sir type depression, not psychiatry topic. मुझे अच्छा नहीं लग रहा, मेरा पढ़ने का मन नहीं कर रहा, मुझे नहीं मजा आ रहा, मेरा नहीं होना, इस बार भी नहीं होना, मुझे बहुत लो फील हो रहा. कोई बात नहीं, बेडशीट लेके अपना आराम से सो, पिल्लो लेके, सोचते हुए कि यार बहुत टेंशन हो रही, बहुत ये टेंशन भी हॉबी बन गई है. बहुत मजेदार हॉबी है ये. टेंशन सेव यू फ्रॉम द हार्ड वर्क. क्या बात है, हार्ड वर्क ना करना पड़े, मेरे को टेंशन हो रही है, बहुत अच्छी बात है. नहीं होगा उससे. As elder brothers, we all want to make you aware of this thing that पढ़ाई वो युद्ध है जो अपने विरुद्ध है. मैं पहले बताना चाहता हूं बेटा, तुम्हारा मन तुम्हें हमेशा बोलेगा मुझे लो फील हो रहा है. ये लो फील होना ब्रेन की अपनी इन्वेंशन है टू सेव यू फ्रॉम द हार्ड वर्क. बेटा ब्रेन हार्ड वर्क नहीं करना चाहता. ये बहुत न्यूरो ट्रांसमीटर रिलीज करने 2-3 तुम्हारे उल्टे पुल्टे और तुम्हें लो फील होना शुरू हो जाता है. फिर आराम करो ना बेटा, कोई दिक्कत ही नहीं है. एंड देन यू आर एक्सपेक्टिंग योर पेरेंट्स ब्लेसिंग्स, पेरेंट्स प्रेयर्स टू बी आंसर्ड. कुछ ज्यादा नहीं मांग रहे नेचर से बेटा, कुछ ज्यादा नहीं हो रहा. हार्ड वर्क तो करें पहले. अगले दिन हमने बायोकेमिस्ट्री खत्म हो गई, ऑप्था भी रिवाइज होगी, 100 क्वेश्चन गाइनी के, 100 क्वेश्चन ऑप्स के, कुछ तो किया. आप 7 डेज ऐसे जी लो मेरे कहने पे. 1.5 घंटे की ब्रेक, एवरी स्मॉल ब्रेक इज 30 मिनट, एवरी बिग मील ब्रेक इज 1 hour 30 मिनट. नथिंग इज इम्प्रैक्टिकल बेटा. You can take complimentary shower every day from our side, no problem. Give you adequate time to fresh होके. आप 7 days ऐसे जी लो. मैं तुम्हें बता रहा हूँ, तुम्हें किसी की जरूरत नहीं है. You will be independently floating कि भाई अब पता नहीं होना नहीं होना तेरे हाथ में, मैं पढ़ाई तो पूरी कर रहा हूँ. I'm doing a lot of hard work. That feeling will give you a little bit solace कि भाई पढ़ाई तो कर रहे, तो बाकी देखते हैं. To get that feeling, please get into the mode of absolute devotion. You know, like that is, there is no bargain on that. Nature has no mercy for those people who are predicting their failure and not doing anything for a better outcome. I'm sorry, I'm from Punjab, a bit straightforward, but that's what we are genuinely wishing, that each one of you who's listening to us at this moment or not listening to us also, preparing for this exam, must pass the exam in this school. May your parents' prayers be answered, but that's only 5% of the game. 95% is your game. 148 तक की जर्नी आपकी अपनी है बेटा. दो क्वेश्चन तुम्हारी मदर की ब्लेसिंग से ठीक हो गए, दैट इज अ पॉसिबिलिटी. पर एक काम करते हैं, मेक योर ओन प्लान बेटा. Everybody is on a different journey. Somebody is repeating, somebody is first timer, somebody read over there in Kyrgyzstan and then came over here is first time, versus somebody came over here without reading anything. Everyone has different type of preparatory level at this moment. Assess yourself, make a plan, how many days you want to give. Sonu Pawar told very clearly, very rightly, that 19 subjects are important. And execute the plan. हम प्लान तो इतने बढ़िया बनाते हैं भाई, देख के मजा आ जाता है. एग्जीक्यूट करने के टाइम पे कॉम्प्रोमाइज, हमारे ब्रेन रोज रात को ऑफर देता है आपको, आज सो जा, कल से अच्छे इंसान बन जाएंगे. कल नहीं आएगा, पेपर पक्का आ जाएगा. आज से पढ़ते हैं. नदीम सर.
Okay, sir. Thank you so much, sir. I think most of the queries of the students are actually answered, sir. सोनू सर, एक क्वेश्चन बच्चों ने अलग से पूछा, तो मुझे व्हाट्सएप पे पूछा है.
हाँ जी सर.
Non-clinical subjects are very much volatile, like microbiology, pharmacology, anatomy, physiology, biochemistry and all. जो इसमें से कोई सब्जेक्ट को मिस कर सकते, छोड़ सकते हैं क्या?
तो वही तो स्टार्टिंग में बोला सर मैंने कि like you can't miss any subject. So this is what is the most of the students they do the blunder, that they leave out certain subjects. So you should not leave. And if at all you feel that you are entirely very less confident in this particular subject, so at least see the PYQs, because sir, you will also like fully agree that nowadays integration is coming.
True, sir.
And our subject is that sort, like it integrates with ENT also, pedia also, PSM also, medicine also, surgery also, in fact, ortho. So if you have a sound knowledge of these particular ones, like micro, you are not reading only 13 questions. Actually, infections, hepatitis, HIV, they want to come in every exam. They are born to come in every exam. So obviously, if you have a good base in them, so you able to hover around 30 questions around. So that is what is the use of these non and paraclinical ones. So basically, take is this only. Don't leave. Just see up the previous, मतलब पुराने जो है at least 3 से 4 साल वाले PYQs देख लो उसके, और मतलब जहाँ पे लगता है कि अब ये बस का नहीं है, कॉन्सेप्ट ही समझ में नहीं आएगा, रॉट लर्निंग करो, मतलब इन सम ऑफ देम. एंड और कुछ जो है जहाँ लगता है कि लेस यू कैन अंडरस्टैंड एंड यू कैन डू द PYQs एंड ऑल, तो वहां पे उस तरह की स्ट्रेटेजी अपनाओ. लेकिन डेफिनेटली मेरी तरफ से ये बहुत बड़ा मतलब नो है कि कोई भी मतलब सब्जेक्ट छोड़ के मत जाना. डोंट लीव एनी सब्जेक्ट, बिकॉज होता क्या है कि लाइक इन फॉरेंसिक 10 क्वेश्चंस हैव कम एंड दे वांट टू कम. and they all were easy and you left it and you landed with 145. Whose fault is this? Those 5 simple forensic questions you would have done right if you have done this. So this is the blunder which I mostly see up the students they do. So this is a blunder only, that if you leave up any subject untouched, because I have seen like certain examples are there, so students they tell that I have left up anatomy, I have left up physiology, and then I passed. So the people they take the motivation from them. They left out 2 subjects and they still passed. This is like what do you say, तुक्काबाजी टाइप्स. कभी कभी हो जाता है ऐसा कि हाँ भाई निकल गए. अब उनके मार्क्स आप पूछोगे जो पास हुए वो 155, 150, 151. तो उनके सब्जेक्ट जो उन्होंने छोड़ के गए सब्जेक्ट, that particular one they are getting this range marks, they are not getting 180, 190, 200. और simple फंडा है सर, like up till those students who wants 150 marks कि मेरे 150 आ जाएं और बस मुझे और कुछ नहीं चाहिए जिंदगी में, क्योंकि ये माइंडसेट होता है जब मैं क्लास में पूछता हूँ ना कि लाइक हाउ मेनी स्टूडेंट्स दे वांट 150, लॉट ऑफ लाइक सबको चाहिए 150, लेकिन कुछ मैं मतलब लाइक व्हाट आई आस्क इज लाइक हाउ मेनी दे जस्ट वांट 150 और इतने आ जाए हो जाएगा हमारा काम. तो सीधी सी बात है, ब्लंट है कि मतलब 150 मांगने वाले लोग 150 नहीं आएगा. जो बोलेगा कि 200 से ऊपर आएंगे मेरी प्रिपरेशन उस तरह की है कि मतलब इस तरह की प्रिपरेशन करूंगा मैं, अभी 175 डेज है, 75 these particular days are there with me, तो इस तरह की प्रिपरेशन करूंगी 200 से ऊपर आएंगे. जब तक आप उनके बारे में नहीं सोचोगे, जब तक 150 क्रॉस नहीं होगा. बिकॉज आई हैव सीन अप सर, so many students are there like who scores a very good 170, 180 and they lands up below 150. So until you cross your barrier to that particular level of 200, you are safe. Even though a lot of like somebody was asking in the exam, like this comment section, that some questions are born to be so difficult and all that. That's true. They will always be that way. Those questions will always be that way. What you can do regarding them, it's for everybody. But still the students, they score about 200. Still the students scores 175, good marks also. So it doesn't matter if some questions are difficult, but if your basics are clear, if you have done a thorough revision, if you have not ignored any subject fully, you will definitely pass for sure. Okay, this is a simple trick. And if you are stuck up in the GTs, don't worry, doesn't matter. See properly which subjects you are very weak, which you tend to do questions wrong again and again. You should see that particular one slight bit with more knowledge. That is that what mistakes you are doing, rectify them, write them. If you're doing up any like art subject, you are doing up this culture media there, see that particular video from QRP session of mine and all that. So at least in one gist, all the culture medias will revise. Similarly, regarding the stains, any MCQs, like I have some tricks for these particular ones. And I have seen this, some of the questions are like direct micro and some are in the integrated form. So integrated form is a sort of good only because what you have multiple hints in that. So like suppose you don't know the microbiology part, you can answer it from pediatrics part. You don't know from the ENT part, pseudomembrane stuff, you know for it Albert stain. So this particular approach definitely helps up, and leaving any subject is a poor idea from my side. And desperateness should be there to pass. Until the desperate is not there, na, ki that which looks in your efforts, which looks in your everything, ki this time I have to do it. Because you have a limited time, don't take it at a 5-year plan that I will pass later and that we'll see. No, this is what is there. And after this, nothing is there. Simple. If you have this particular attitude, then only you will succeed.
Okay, sir. Thank you so much, sir. So Dr. Sandeep, sir, Dr. Bhakti is asking how to tackle the question which are totally not familiar, because sir, like most of the question, like in medicine and systemic pathology, so these questions will be very tricky and very big questions they are asking, sir. So, Dr.
Sir, it is very difficult to say. It will vary from question to question, but I have a few tricks which I feel. See, end of the day, even if you blindly mark, you have a 25% chance of getting the answer correct.
Yes.
A point ye hai ki how to increase that chance of getting the correct percentage. There are 2 or 3 things that can be done in this scenario. First thing, in case a question is talking about, I'll give an example. Question says, which of the following condition has least risk of developing neuroblastoma? Least risk of developing neuroblastoma. And there are 4 syndromes given. 3 of the syndrome you have never read about in your life. And 4th option is Down syndrome. The likely answer is Down syndrome, because examiner in FMG exam very rarely puts rare things. Common things are commonly asked, and going by, even if you have not read. Now, if you read in details, then you find that Down syndrome has higher risk of developing leukemias, but the chances of solid pediatric tumors is less even than general population. This is a fact. Suppose you don't know the fact, go with the more likely answer. That is always correct. That is the first thing. Second, in case it is a case scenario given to you, and it is a long case scenario, say 7 or 8 line long, start from the bottom. Read the last line and see what is given there. Many times they will be simply asking you what is the diagnosis or what is the drug of choice. So just look at the question later on so that you have an idea. You don't waste your time, first listening to the entire story. I'll give you another example of an actual question. There was a man who went to Himalayas for trekking, came back. He had fever for 7 days. He had a small black necrotic lesion on the shin, which healed spontaneously. Then the patient had hepatosplenomegaly. Then the patient had lymphadenitis. Eventually, Wheel Felix test was positive. What is the drug of choice? If it is rickettsial infection. If you did not read the entire first 5 lines and simply read what is the drug of choice in rickettsial infection, you would know the answer is doxycycline. So in a long scenario, you're running short on time, read the last line. Third thing, if you have 4 options given, statement-based question is there, and somebody is saying, this is 100% true, or this is never seen. Remember, in medicine, in the world of medicine, there is no such thing as 0% or 100%. That is not the answer. So you can rule out that option. And so now, if you have ruled out 1 or 2 options like this, you are left with only 1 or 2 options, and those are the correct answer. And fourth way, look for contradictory options. If there are 2 options which are in contradiction with each other, and the examiner is asking identify the true statement, only 1 out of these 2 should be correct, and now you have a 50% chance of getting the answer correct. It will not happen in a day, but try to see. Case scenarios given to you, they are talking about rash, but fever is not there, unlikely to be an infection. If they make a case scenario of an infectious agent, it will be having fever with rash. So if they say rash with your child not growing well, think of micronutrient deficiency. If they say rash present with fever, then zinc deficiency will not be the answer. It will be as a viral infection, right? So you have to apply a bit of common sense. Practice is where the rule comes in. Practice more MCQs. As Sonu sir also said, as Dr. Priyansh also said, 70 to 100 you can start, but as Rajiv sir said, aisa nahi 250, 300 kar lena din mein. That means you are overdoing it. You need to read the question, look at the other options also, why they were not the correct answer, form generalization. And last point, when you do revision, in the revision, particularly last 1 month, time to read and understand pathophysiology is gone. No pathophysiology for even a single subject in all 19 subjects. Now you just have to read the topic and identify and remember the key point. The 6 or 7 things are actually asked in any topic. If it is not a very big topic, what is, suppose it's a syndrome. What is the genetic abnormality and the chromosome? What is the type of inheritance? What is the hallmark feature? Is it malignant or not? What is the investigation of choice? Is there a drug of choice available or not? Any prognostic factor? Actually, 7 or 8 points are there, and they are written in your notes. So focus on these things. Do not focus on lengthy things, rare things, random things. A lot of people ask me, sir, FOMO ho raha hai. I have not read this topic, that topic. Somebody was saying that is important. I simply ask them, have you done pediatrics? They say yes, sir. Milestone kar liya, severe acute malnutrition कर लिया, सर एक बार पढ़ा, कॉन्फिडेंस नहीं आई से, जब वो टिप्स पे आ जाए उसके बाद then think about any other topic. So get your priorities correct, and when you sit in the exam, जो आपको नहीं आता, किसी को नहीं आता, apply logic. The more logical answer is always the correct answer. So some suggestions from my end, sir.
Okay, sir. Thank you so much, sir. Dr. Shivani Malik, yeah, I will try to do that. Some students have also asked, sir, you give us a plan, how to fix the number of days. So I have made a small presentation for them, sir. I can share with them. Yes, all of you, I hope you are able to see my screen here. Like what should be done in last 75 days, right? See, first of all, see, like some points from my side, like minimum there should be, see, overall, are you able to see my screen? Is it visible? I think yes. Okay, fine. See, minimum there should be 2 to 3 times of revision. Save last 15 days for final revision. minimum 6 to 8 mock exams should be there. See, remember here, see, when I say write mock exam, so what does it mean? Please remember here, after writing the mock exam, you have to reassess yourself where you have done mistake. And most important thing is that for next 75 days, you have to stay disciplined. Most important thing is that 6 to 7 hours sleep is most important. Second most important will be your diet, means what you are going to consume, what you are going to eat. You have to stay healthy in last 75 days. Suppose if you are getting loose motion, if you are getting diarrhea, suppose if you are getting fever, this is your problem. You had to take care of yourself. Fine, no? See, remember, because if you will be getting loose motion, if you will be dehydrated, you will be wasting one day for sure. So please be careful about your health. Sleep and diet, most important thing. After that, second most important thing will be the time management. Second important point, see how to assess our mock exam. Some students are saying, sir, we are scoring less than 150. Some students are saying, sir, we are scoring more than 200. See this paragraph. See, remember here. See, ideally, you will be writing minimum 5, 6, or 7, or 8. 8 mock exams you will be writing. Okay, fine. Sometimes you might be scoring 120. Sometimes you might be scoring 180 or more than 200. So you may be facing, like sometimes there will be fast ball of Shoaib Akhtar, but sometimes there can be easy ball also, right? No, sometimes you might be writing some exam which will be very, very difficult, but sometimes exam could be easier also, right? No, so remember here, even if you are scoring less than 150 in your GTs, you should not be disheartened. If you are scoring more than 200, you should not be overconfident. Please remember, mock exam will make you understand that are you on the right track of exam preparation or not. This is the important thing which you have to understand with the help of mock exams. It can go up, it can go down, but let it be. Most important thing is that are you writing mock exams or not? Fine. Very, very important thing, right? So you have to keep on writing. You have to keep on writing. Next important point, see what about the subjects? Right? What about the subjects? Please remember here. See, yes, so how they are framing the questions, what kind of question they are going to ask. Please remember, see, the more, maximum number of questions will be clinically integrated, minimum 160 to 170. Image-based question will be 20 to 30. And see, please keep in mind, one-liners will also be there, 80 to 90. So see, remember how to understand, see, like in the anatomy, you cannot expect only one-liner question. I expect 5 or 6 one-liner question in the anatomy, but most of the anatomy questions will be clinically correlated, clinically integrated with surgery, radiology, orthopedics, obs, gynae, ENT, everywhere. Microbiology will be integrated with medicine also, surgery also, pedia also, everywhere. Right now, so remember here, so one-liners are also important, but how to integrate the subject, that is also important. Okay, some questions will be related to clinical practice, right? How to auscultate the patient, how to do abdominal examination, what is the right sequence. Suppose if a nurse was taking blood sampling, like after that 1 drop of blood fell on the floor, which chemical you are going to use to clean the floor, right? So these kind of questions, I'm sure your faculties would have taught you. Right? After that, see, what about the subjects? See, non-clinical subjects like anatomy, biochemistry, physiology, microbiology, pharma, patho, minimum 2.5 days should be there for 100% revision. Okay. See, one more time, you have to revise from the same notes of the same faculty. Okay. But big subjects like medicine, surgery, obs, gynae, PSM, minimum 4 days you have to keep. For ophthalmology, pediatrics, ENT, minimum 2.5 days. But a small subject, short subjects like psychiatry, radio, ortho, anesthesia, forensic, and derma, 1.5 days. So in total, you will be investing 48 days for one more solid revision. After that, please remember here, 48 to 50 days you have to keep for full revision from the same notes. But now there should be aggression in your revision. Means like earlier you used to learn, okay, like this, but now you have to be very, very much active. If you are not sleeping properly, you will not be able to revise all the subjects on time. See, in total, 6 to 7 days you will be you will be in the need to keep for the mock exams and revision. Last 15 days should be separate, because whatever you have learned in last 6 years during your MBBS, that is the one part of your exam. And after that, how much you have learned in last 5 months, that is the second part of your exam preparation. How much you are going to revise in last 15 days is going to matter. Okay, no, so that will be giving you fresh memory. Right now, 4 days I have mentioned here. For the extra 4 days means whatever topics you will be left with, you can revise those topics. But remember, the most important subjects from where you can score more: surgery, obs, gynae, PSM, patho, optha, ENT, pedia. And short subjects, please don't miss any short subjects, because there will be, see, like in forensic, there will be 10 questions, no? And see, but these 10 questions are very, very easy. There will be, see here, so out of these short subjects, no, forensic, ortho, psychiatry, you will be having very high accuracy. There will be some risk of doing mistake in medicine, in surgery, in gynae, but very less risk of doing mistake in forensic, psychiatry, anesthesia, derma, radiology, and all. Please remember here. So whenever you are revising 19 subjects, you are supposed to focus more on these subjects, right? Now, okay, but remember here, so whenever you will be revising your medicine, at that time your patho should be integrated. Don't miss patho. See, out of 6 non-clinical subjects, the most important subject will be patho, right? Okay, fine. See, after that, how to divide your time? See, what I give the rule: 15 plus 9. Every day you have to keep 15 hours for a study person. As Dhawan sir said, ki every day you have to learn for 13 hours. Yes, if you sit in library for 15 hours, then you will be having productive 13 hours. If you are sitting in a reading room for 14 hours, then hardly 12 hours. If you are sitting only for 11 hours, no, your productive study time will be only 9 hours. Okay, so every day 8 to 10 hours there should be solid revision. For 2 hours you have to keep for question practice. Every day 75 to 100 questions with rectifying the mistakes also. And every day please have group discussion, because when you do group discussion with your friend, no, so this will make your short-term memory into long-term memory. Okay, that will be very, very much supportive for you. 9 hours every day. Please sleep for 6 to 7 hours, and 2 hours you can keep for miscellaneous activities, right? So 15 hours a day, 7 days a week. There is no substitute of hard work. Remember, see here, all of you may not be master in all 19 subjects, but at least you can be master in 14 to 15 subjects. No, so you have to work smartly now. Remember, winners don't do different things, they do things differently. You have to keep in mind. And remember, see the last notes or whatever, like sticky notes, if you have made, you have to keep on revising on daily basis, right? So always keep in mind, say this exam is going to change your life forever. The chapter you are learning today is going to save someone's life tomorrow. Okay, so you people are going to join the fraternity of few of the greatest people on the earth. Whatever you are going to write on the paper, that will be playing with the life and death. So be serious about this exam. Be careful that this exam is going to change the life of yours and along with you of so many other people. So I wish you all the best. Thank you so much. And I would like all the faculties to give some last piece of advices. Thank you, sir.
Thank you, Nadeem sir. I think you can screen sharing probably is going on. Yeah.
Okay, sir. I have stopped, sir. Yeah. Yes.
Okay, guys. I think you must have got some inputs for your next 75 days, and if you can understand that, everybody is different, and decide the plan as per your current situation. What kind of effort you need to make for a certain subject, you know it. But yes, please make a plan and execute that plan. Most important thing is that do not really be lethargic anymore, because one thing we can do definitely, we can stop predicting a failure and we can start working for the better outcome. That is for sure. That I think anybody who is having, clarity that how much is the value of this exam would certainly devote now every day out of these 2.5 months for the preparation of the exam in their own way, because your way will be particularly suited for your current assessment which you have. But yes, GTs are important. Following the timelines are important, and we will be certainly coming back to you in between again and again, like certain other things. And don't worry about it. We are all working together for the best outcome for you and your families. And I wish you all good luck for putting your best foot forward, first of all. Thank you, Nadeem, sir.
Sonu, sir.
So friends, in the last, I like to tell only the quote of the great actor Shah Rukh Khan, which he tells up that जिंदगी में जो भी काम करो वो इतनी शिद्दत से करो, इतनी लगन से करो कि एक तो काम को फक्र हो कि तुमने उसको किया है, एक दूसरा ये कि मतलब जिंदगी का ये आखिरी काम है, इसके बाद काम करने का मौका नहीं मिलेगा. जब this type of attitude you have na, that this is the attempt which I have and I have to do my best in this. When you have this particular mindset, then you do everything great, and do with this mindset your work and your studies, you will definitely succeed. A very best of luck from my side.
Thank you so much, sir. Sandeep, sir, last piece of advice. Sir. I think Sandeep, sir, is there. Yeah,
I
okay,
think
fine.
Sandeep, sir.
Yeah, okay. So overall, this was a great session today, and thank you all the faculty members for joining us. And I'm sure most of our students would have been benefited today, and we wish, like on the behalf of entire team of DocTutorial, I wish everyone all the best. Thank you so much.
Best of luck.
Thank you everyone for joining us. Yes, sir. Okay, sir. Thank you so much.
Thank you very much, Nadeem, sir, for hosting it so nicely to bring out the best point for the students. And thanks a lot. Thank you.
So always a pleasure to have
Thank you, sir.
Any kind of session with you, sir. Thank you so much, sir.
Thanks a lot. Take care, guys.